get started, we have exactly 1 hour to try and make as much of an impact as we can. My name is April Holman. I'm with the Alliance for a Healthy Kansas. And the reason that we have this event tonight is because there are discussions underway in Washington about really large cuts to the Medicaid program, among other things. And we know that regardless of how they choose to structure those cuts, it's going to mean that there will be people in Kansas and all across the country whose coverage is terminated if they enact the really large cuts that they're talking about. And by that, I will say right now it's $880 billion over the course of 10 years. So that would have a significant impact in Kansas, in particular on seniors in nursing homes, on children, on their very low-income parents, on pregnant women, and on people who have disabilities. So those are the people who qualify for Medicaid today in Kansas, and if we had to absorb cuts, those are the people who would be likely to be caught up in those cuts. So we invited the delegation members from District, this is 4, right? Yes. 4, this is 4, sorry. And they weren't able to be here tonight, but we are live streaming on Facebook. We are going to be taking pictures in the room, and we're going to be capturing comments in written form as well. I say that now before we get started because I want to make sure that everyone realizes that there might be a picture taken of you. You might be in the live stream, so if you're uncomfortable with that, it is absolutely no problem, but this would be the time to step out. With that, I think that we're going to go ahead and get started. Just depending on how many people we have who want to speak, we will just kind of gauge how long the comments will be. I think if we start out thinking about 5 minutes, that would be probably a good benchmark. So we're going to start with Sherry Coatney. Hello, Sherry. And she is going to kind of be our lead-off person.
Hey, Wichita. Hi, guys. So, I'm smiling because I'm happy to be here, but we're not here for a very good reason. So, I mean, we all know we're here because we're terrified, right? I mean, I'm terrified. I had somebody recently tell me that I seem angry. And I was like, I'm not angry. Please don't misunderstand that. I'm terrified. I'm terrified about the people who I care about. Terrified about my children in my home. And I know I'm too old to have children in my home, but I raise children with disabilities that I call my children, even though they're not biologically mine. And I have a child on the TA waiver, which is a technology-assisted waiver, and she has to have technology to keep her alive. And then I have a child who is on the IDD waiver, and he has autism, and again, he has to have supports to be successful, and we're getting ready to transition into adulthood, which is really exciting, unless you listen to the news, and then it's terrifying. Terrifying. So let me explain why it's terrifying. As we know, the Trump administration has big plans, and they're doing all sorts of crazy alterations to the way we know government, and so along the way, they also are trying to make things fit where there's not room for them to fit, like tax cuts that we won't probably see benefits from, but tax cuts nonetheless. So they got to fund those tax cuts. So the first thing they've done is try to, have been working diligently to cut $880 billion with a B, $1 billion from Medicaid. What? I mean, how does anybody in their right mind think that's okay? Well, when this happened, the Alliance and people started, rallying up the troops and making awareness and talking about it and getting their advocates and folks in DC to get us information, and we started making calls. I mean, I run an independent living center, and we have about 100 employees, and so our job was every day you come, you clock in, you make your calls. You call those federal legislators, and you tell them to stop it. Don't cut Medicaid. And so we did that, and we did that, and we did that, and we did have Senator Moran stand up and talk about the fact that this would be devastating to Kansas. However, he still voted for it when it came time for a vote. So, I'm not for sure what political games are being played, but even when they know it's wrong, they're still doing it. And it's terrifying. It's terrifying because, when I was talking to some of the Kansas legislators, I said what's going to happen is if this passes in D.C., what it really means is that less money's coming to Kansas and you have to make the decision. You, our Kansas legislators, are going to be making decisions about who does or who does not have medical coverage. Who does or does not have the services that they need. I said, do you want that? I mean, they need to be ones taking the phone calls because the heavy's going to be on them. And I'm old and tired. I know that it's going to be a fight. And I'm willing to fight. But man, it'd sure be nice if some people were fighting with us and not always feeling like we're just coming up against the wall. And so, I expected our Kansas legislators to make those phone calls too. Because what's going to happen is they're going to start looking at optional programs. And what is optional programs? People are like, what does that mean? Like stuff you can or can't do? Well, kind of. The state of Kansas has here's the things the federal government requires Medicaid to pay for. And then with some Kansas money, they can pull down federal funds and have optional programs like in-home care for people like my daughter who has to have technology to live. And if she doesn't have that technology and that nurse in there assisting her, she wouldn't be in my home for me to raise. She'd either be deceased at 11, or she'll be in Children's Mercy Hospital living because they're the ones to be able to provide her care. So they have to decide about her program, or my son with autism's program, or somebody with a physical disability that was just in a car accident and, needs in-home care suddenly, or somebody who's, one of our elders who is getting to the point where they need to be assisted or have to go to the nursing facility. And I don't know about you, but I've never heard anybody say, I can't wait till I get old and move to a nursing home. Anybody ever said that? No. Because we all want to live in our own homes. We want to live in our own homes and we want to stay where we're in control, right? We all want control. So we want to make sure that our elders have, in fact, been given the respect they need and deserve and have earned by having in-home care available for them. We don't want to be a legislator that gets to decide, we don't go to the nursing home. Well, because guess who's going to pay for the nursing home? Medicaid. It's still going to pay for the nursing home. They're still going to pay for the hospital care. They're still going to pay for the institution or wherever people go. I just don't think they all understand all that. That it's still going to become a tax problem for Kansans. So all the tax cuts they want to give now, they're going to have to take back later. So anyway, I know that I need to wrap it up because I can just keep talking and talking and talking, and there's plenty of other people in here that want to talk, and if we run out of talkers, I'll talk some more. But 100% I need you guys to get behind me because I'm going to say 880, and you're going to say? Billion. We're going to do it.
We're in the library, so we're already...
Okay, I won't, yeah. Sorry. I'm still going to say it. 880 what?
Billion.
Oh my gosh, right? Okay, so... She knows me. I would have had you guys screaming earlier. So, woo, she had to remind me, we're in a library. But guys, I'm so glad you guys are here. And you have a job to do, though. Before I go sit down, your job is you got to tell your neighbors. You got to tell your kids. You got to tell your grandkids. People need to understand what we're talking about. This is not okay, and everybody has a responsibility because the people in Washington and in Topeka were elected by you. And so, and even if you didn't vote for them, they still work for you. That's their job. So tell them over and over and over again, they have to fix the problem before the problem becomes bigger than they realize. So.
Thank you so much. The next speaker on our list is Rick Macias. Actually, would you like me to bring you the microphone? Okay.
I'll have you stand up for a second if you would. Yeah. Just a little bit, and let him through, and then pull him over here. Is that okay? Oh,
Yeah, wherever you want. Yeah, this works. Can you adjust? Yes.
yeah, and I think this is, yeah.
Hi guys, my name is Rick Macias. I'm from Chanute, Kansas. And I'm also here to talk about what Medicaid cuts would do and how they would affect an everyday living person with a disability like myself. Medicaid cuts would affect me as in the aspect of not being able to have staff to help take care of me, not to be able to shower or run errands and do the normal things that people need to do. But while having services that I do have now without the cuts, I'm able to live a successful life just like anybody else would. Go to the store, have pets, be in my own home, pay my rent, pay my bills. And it also allows me to get out and work and help the community and help other people in our community that is disabled, that doesn't know about the resources that is out there, as far as like being able to get curb cuts fixed, or buildings that they can't get into, they wouldn't know who to contact, because where I live in Chanute, I have a good relationship with the city, where if there is something going wrong or a building owner is not up to code, they call me and I go check it out and I work with them to get it accessible for people to get into their building or have business from people with disabilities. So these Medicaid cuts would hurt us in a major way, as far as like not being able to get out of our homes, not being able to go shopping, not be able to have the staff that come in and take care of you, because without the services, that gives the staff a job. Because if we didn't have these services, then staff would have to go find a regular job, and we would just be stuck at home by ourselves, in the hospital, in a nursing home. So it's really a benefit, and I wish that the people in Washington, D.C., instead of sitting behind the desk, writing the laws and saying we're going to make these cuts, why don't you try being in our shoes to really see how our lives would go, and then maybe you would have a better understanding of it, versus just writing the law and saying, you know what, we're going to make these cuts, even though we don't live that life. We sit behind a desk in a fancy suit and we make the decisions, when really they don't know that it's not only, it's the decisions that they make is not impacting them, it's impacting everybody that has a disability, and people that don't even have a disability, just the low income people that need Medicaid to even help them. It affects everybody, and they just don't realize what they're doing. They don't realize it at all, that it can harm people in a major, major way, and you have a major impact. And they just don't understand, because they don't see it. They don't have to worry about it. But then also at the same time, they're not thinking about the fact is when they become like elderly or up there in age, like maybe their parents, they're gonna get there where they're gonna need the same type of help that we're receiving now. But they're not considering that. They're looking at the money that's going into their pocket, or they're looking at the money that's gonna save the government. They're not thinking about their future. Like me, working and stuff like that, I love making an impact in the community, or traveling to do events like this. This is the kind of things I want to do, because I live this every day. This is my life, being in a wheelchair, so you have to make it work. But when you got the government over here fighting against you to say, we're going to take these things away that benefit you every single day, that can hurt a person majorly. So they just need to hear from all of us, because I made those calls too that Sherry had talked about, and I got Senator Moran to listen to my story and listen to how having the services does help in my everyday life. But he was the only one. The other ones just hung up on me and said they didn't want to hear it because they had already heard a million of our stories. but at least I got one to listen, to have it in the back of his mind that, you know what, we do have disabled people. Because I told him my whole entire story. I think I kept him on the phone for maybe like 10, 15 minutes, just running down my whole story of how I'm able to live successful with the services that are provided to me. And I wasn't going to let up because he kept telling me several times, okay, I got to go. Well, I was like, one more story. Let me just tell you one more story. So I kept him on the phone as long as possible to listen to what I got to say. And he sat there and listened. He told me 2 or 3 times that he had to go. Did I care? No, I continued with my story. You're going to listen to what I had to say. And so that's my point, is that we got to make these calls and we got to make them understand that this is going to harm us. And this is not only going to harm us, but when you get up there in age, what are you going to have? There's going to be nothing available. Then what, you're going to go to a nursing home or facility and just die? I don't want that, and I'm sure nobody wants that. So why not let's cut down the funding for the nursing homes and make more funding for the home community-based services versus paying the nursing homes that really just doesn't care about you. They want to lay you, they want to put you in bed, want you to be on all kinds of medications, feed you when they want to feed you, change you when they feel like changing you. And they're going to be there one day. If these things go away, that's where they're going to end up. And then they're going to be like, dang, I should have done something when I was one of the senators elected. Yeah, it's too late now. So are we going to wait for that to happen in order to make these changes? That shouldn't be. The changes should start now, not later when you can't make the changes anymore. Thank you guys. I appreciate it.
Thank you, and were you wanting to speak?
No, I just wanted to ask a question. What percentage of Kansans rely on Medicaid for health care?
So the question from the audience is, what percentage of Kansans rely on Medicaid for health care? I don't know I guess I do. So that would be the number of people who receive Medicaid. And that number is about 420,000 people. So I can't do math in my head very easily, but I'll tell you what, when the next person, what did you say?
8%?
That would be the entire city of Citrus.
Mm-hmm.
Yep.
I feel like it's more than 8% because the total population is about 3 million. So I'll figure it out, but I will tell you that for nursing home care, it's over 53, I think it's like 53% of nursing home care is paid for by Medicaid. There is a large number of children who have their care either through Medicaid or the Children's Health Insurance Program, which is a subset of that. There is a very large number of children who are born and their mothers were covered with Medicaid. So I think this is something that is definitely an issue that we need to watch and be careful for because it would have a huge impact in Kansas. And right now, we don't know how these cuts are going to look. They're deciding that within the next couple of weeks in Washington. So this is the time that we need to say, we don't want to see any cuts because they would really have an impact on people. There's no way to do this level of cutting and have it just be making sure there's no waste, fraud, or abuse. This will cut the coverage that people have. So I hope that answered your question, and I think the next person that had signed up was Haley Cotner. So.
Hi everyone. My name is Haley Kotler. I'm a 5th generation Kansan and proudly from Wichita. I'm here today because I'm deeply concerned about cuts to Medicaid and other safety net programs. My mom lives with a disease called Pompe's disease. It's a rare form of muscular dystrophy. Essentially it attacks her muscles and that includes her breathing. So she's bedbound, she breathes on a ventilator, and she relies on care. Myself, I'm employed, but I also take care of her, not around the clock, but as much as I can, and she has caretakers that come in twice a day. I'm part of a lot of online forums for families who are impacted by muscular dystrophy, and I just have to say right now, folks are full of panic. These are people living with muscular dystrophy, their family members, caretakers, and daughters like me, and it's a lot of sheer panic. I'm seeing anything from will these cuts impact me right now, what's going to happen, to what do I do if this happens. People feel like they may be on the streets or they may not have their health care that they need to survive. My mom's disease has a very, very expensive way of mitigating it, so a lot with her more rare form of muscular dystrophy are scared because Medicaid does cover this, and it's life-saving. It actually saves their lives. Without it, they would not be here. So with that, people are terrified, worried that they'll lose access to life-sustaining treatments, medical equipment, or even basic needs like food. These families are already carrying so much, and often these programs are really what is keeping them afloat. Of course, I think I know that this room agrees with me, but we're talking about real Kansans who will suffer if these cuts go through. Please do not take away these lifelines that so many rely on across our state. And then just to add maybe for the room, I am an advocate for work, and I was recently in DC, and folks are hearing this in the meetings that I were in. Medicaid continue to come up, so please continue to reach out and to talk to our members of Congress because it does make a difference. Thank you.
Okay, and so as promised, people were able to sign up ahead of time, but you are welcome now to come up and speak if you have a perspective that you want to share, and we want to make sure that the members of Congress that represent this district are hearing from you all about the concerns that you have. Are you showing me that someone wanted to speak?
Taylor was signed up for that list.
Oh, okay, great. Thank you. Would you like to come up, Taylor?
Yeah, let me find my notes.
Okay.
Can you guys hear me through the mask? Okay. So my name's Taylor. That's my auntie Chandra. And I'm a social worker, so that means a lot of things. I can be an advocate, I can be a counselor, but it does mean that at one point in my life I promised to uphold some ethics, which is recognizing the dignity and worth of a person and challenging social injustice. So, let me take the mask off. That obviously is here. I spent roughly a year resettling refugees. Every single case required came here. So these people are forced out of their homes due to imperialism. Then they come here. These cuts would mean they can't get medical care in the country that destroyed their home. Whew. I'm recovering from double pneumonia. Sorry. This could also impact me personally. Recently, I was diagnosed with a chronic, incurable illness. Those of you who lived through the 1980s, you remember the epidemic. So personally, I don't use canned care, but pretty much everyone who sees my doctor does, or Ryan White. We have to see our doctor once a month, minimum. We have to have lab work done. Most of us take one pill a day, keeps us going. But without canned care or Ryan White, those people will die. And you remember that if you were through the epidemic. So this is important for your friends, for your neighbors. You should know your neighbors. Know your neighbors if you don't. Really anyone. And it's up to us to advocate for each other.
Okay, my team has brought it to my attention that there are more people who have signed up. So I just don't know if they're here or not. So the next person on my list is Christine Bacci.
Yep.
Yep. Yeah, so sorry. I didn't mean to overlook that.
No,
people were
it's
down.
okay, sorry. Let's just speak for a minute. My name is Christine Bacci, and I am here representing actually two home health agencies, Impact Home Health and Thrive Therapy of Kansas. We exclusively only serve the Medicaid waivers. So all of the home and community-based services for the physically disabled population. Let me tell you, I want to take a moment and focus. Obviously, we know about our adults that are under age 65 and require assistance, and then our frail elderly over the age of 65. But I want to take a minute and put a little emphasis on the brain injury waiver. Excuse me. The brain injury waiver is for anybody. A couple years ago, Kansas dropped the T because it used to be called traumatic. There were only 248 people with access to that waiver just a few years ago. They dropped the T. It became the brain injury waiver, so that anybody whose spinal cord or neural system was affected could have access to this waiver. What is critical here is for you to understand traditional insurance across the entire United States. The way our system is set up is that people can have a car accident or a stroke or some type of traumatic event to that brain, and private insurance only covers and gives them access to therapies for 6 months. That is all the federal government mandates that they give them access for. The brain injury waiver, Medicare came along years ago and they listened to science. And science tells us that the brain actually will show recovery and improvements, and a person can make rehab progress years after the injury. And so the government came in and told the 50 states, you need to come up with this brain injury waiver that's going to protect that population of people. So you were talking about this Medicaid program creates the ability for those people who've had these life-changing injuries, okay, whether it was from a gunshot wound or a car accident or a stroke, and they now have access to therapies, physical, occupational, and speech therapy, and then they also have cognitive, behavioral, and life skill therapies for up to 4 years is the current programming. It's life-changing. We are literally seeing people that are in a vegetative state following these significant life-altering injuries who we are able through that intense and long progressing rehab to be able to get up and to be able to walk or to be able to acclimate and get back out into the community. The loss for this program, I know currently there's around right around 1,100 people across Kansas that are on the brain injury waiver. Already, because of funding being threatened, this is the first year that they're already talking about putting it on the waiting list for these people. For Think Rehab, without quick access to these therapies, we struggle to be able to help them to get back as much independence as possible. So it's critical that this access stays available to them and that providers like us are able to get into those homes, get these people out in the community and help them figure out how to navigate life with the brain injury. We don't fix them, that's pretty rare, but we do help them figure out how life can look after the brain injury. And it's a positive life. I'll tell you, Thrive represents currently about 350 brain injury patients. And I can talk for hours about the impact that we are able to make through this program and through this funding that is protecting this group of people that need this critical access to all those therapies.
Thank you. Okay, is Sarah Amador here? Sarah.
Hello, my name is Sarah Amador, and I want to just share a little bit about the way in which Medicaid made a huge difference for me and my family, and what will happen if cuts happen. So I was a missionary in Nicaragua for 10 years. In 2018, there was a huge political social crisis that happened, very dangerous, lots of crises and shortages and all sorts of things. I was 34 weeks pregnant at that time. I decided with my husband we were going to stay, but when I hit 38 weeks, it had gotten to the level of violence that we didn't feel like it was safe to stay any longer. The reason I was able to come back to the States was because of Medicaid, because who travels at 38 weeks without, I didn't have insurance, right? So Medicaid allowed me to come here and have my son safely. He allowed me, through Medicaid, my son, I knew had a developmental disorder, my oldest, but we've not been able to get him diagnosed in Nicaragua. And through Medicaid, we were able to go to a developmental pediatrician, get him diagnosed. He has autism with moderate support needs. He also has ADHD and many other things. Medicaid Medicaid is what allowed me to have my children covered while we were here. Because as you know, when you move stateside, my husband is Nicaraguan, so we had a time period where he couldn't work because he was waiting for his immigration papers. I was at home with a newborn, and we desperately needed those resources. My children were safe and healthy because of Medicaid at that time. It also was what gave me a lifeline when the PTSD from what I experienced in Nicaragua and postpartum anxiety became too much. And if I had not had access to medication therapy, I don't know where I would be and where my family would be. And we worked so hard and had the support of Medicaid to get to where we are now, 7 years past. But now, there's also so many things lacking in that. We are one of the few states that has not expanded Medicaid. The gap between when you qualify for CHIP and when you no longer qualify for CHIP, and then being able to even pay for, like, on the healthcare.gov is a huge difference. And that money matters. It matters for the coverage for our kids. It matters for them getting just preventative care. And I wish that's what people would understand, is that if we don't take care of kids today, they are going to become adolescents and adults with even more significant problems that are going to end up in ERs and much more expensive situations than if we just take care of them now. And another issue that Medicaid has now is the disability side of things. My son is on an IED waiver, and yet we are still 8 months past when we lost coverage last year for the Magic program. We still don't have coverage for him because, again, there is so much shortage. There's a 10-year waiting list for the HCBS services. My child just turned 11, and I had to get him on the waiting list now so that when he becomes an adult and maybe needs some home support, he can have it. And that should not be. And my son's on 4 medications a day, 2 different therapies a week to have a stable life. And we've had to keep just paying those out of pocket, getting support from other friends, because I can't stop his coverage, right? He can't go without his medications. He can't go without his therapy that we've worked so hard to get him here. And yet still. So Medicaid both provided me a lifeline when I needed it, and we still have so far to go. And so to hear about people wanting to just make these massive cuts, not recognizing how it's going to impact our communities, because that's the thing that I struggle with being back here in the States, is that in the majority world, it is all about community, because you don't have anything else. You have governments that aren't functional, you have many things, they need each other. But here in the States, we believe, I can do it on my own. And we have a bunch of people in Washington and in our Kansas state legislature that are more interested in maintaining power, maintaining their status quo, than taking care of their constituents. And we can't let that happen. And I'm so grateful to see so many faces here, and to be calling our representatives and get that their mailboxes are full because so many people have called, because we have to keep speaking up, because otherwise they're not going to listen. And there are grave consequences if they don't. So, thank you for
I think that's a really good point, that in many programs that we have that are related to the Medicaid program, there's actually a shortage of funding still. And at the same time, we're hearing about massive cuts when we really probably need to be seeing increased investments. So the next person on the list is Lisa Harrison. Lisa? Boy, I really blew it when I skipped over you guys. I'm sorry, you're all here.
This is amazing, this group of people coming to advocate. I really appreciate it, and I just learned about this group, so I'm really excited to be here. My name is Lisa Harrison. I am a social worker, and as one of the other speakers said, I do feel like it's my ethical responsibility to advocate for people that are unable to advocate for themselves. About 3 years ago, I found a significant gap in services for people living in long-term care. So I started a company as a therapist where we would go out to senior living communities and provide talk therapy counseling. In that 3 years, we have grown exponentially because of the need. What I wasn't prepared for was seeing what these elderly clients were going through living in long-term care. They are extremely isolated. They're very lonely. They are dealing with a lot of grief, and now they are scared. They are terrified about the Medicaid cuts. That is a lot of what we are talking to with our clients, is dealing with this fear. It's exacerbating anxiety, depression. I am encouraging all of them to speak up, to take action, to talk to the political people that they are in their district. And so just a few things, I do believe that the proposed Medicaid cuts in Kansas would have a catastrophic impact on the geriatric population. These are the people that built our businesses, that fought our wars, that made our community the way it was. I firsthand see the challenges that this population faces through chronic health conditions, isolation, grief, and cognitive decline. Without adequate funding, access to essential care will diminish. Facilities will struggle to stay open. I don't know if you all are familiar, but clients in long-term care get $62 a month. And they live for that $62. That is their access to the outside world. And that has not been increased in a significantly long time. And they're worried that's going to be taken away. They're worried that they're going to be faced to go out on the streets. And that is really scary. So I urge you all today to talk to your local representatives. I just want to speak on behalf of this population. Oh. Yes. Oh, no, sorry. I gotta have access to my paper, so I can. Right? So it is. So I think that's really it. All that I have. I just wanted to advocate for this population of people that I feel are unable to advocate for themselves. Thank you.
Okay, so we have two things to remember when we're up here speaking. We need to be able to be seen on both sides of the room and by the iPad that's there. Okay, so I think that we also have Eric Littweiler. Thank you. I'm sorry if I mangled your name.
That's fine, everybody does. It's a long eye, it's spelled wrong, Eric Littweiler. So I'm the Director of Communications for Mental Health America here in Wichita, and I'm, representing about the 10,000 people that we serve every year, plus the 185 people who are on staff providing nonprofit mental health care to the South Central Kansas region. Traditionally, over the last several years, and probably much longer than that, the number one barrier to getting mental health care has been a question of access. And when people talk about access, they tend to think of geography, Western Kansas and all that. But the truth of the matter is, access far too often is the cost of receiving care. Having insurance policies that don't cover mental health care is something that people tend not to think about. Even as a nonprofit who tries to keep our 30-plus programs a year available at no cost to people who need them, obviously there's a cost to us in providing those programs and providing that care. We're a $9 million annual operating budget organization. We have one fundraiser, and that's me. So it's a challenge because obviously we want to provide care without the barriers of cost. But we also have to pay therapists and social workers and case managers and psychiatrists. So that's a challenge. As I'm sure we all understand from living in a city that's known for aircraft production, it's always easier to try to prevent a problem. It's cheaper, it's more efficient, it's faster to prevent a problem than trying to fix it down the road, and the same is true for mental health. A lot of our programs focus on preventing or on working with youth to find and to utilize healthy and sustainable coping skills to keep the mental health issues that they're dealing with today from turning into mental illnesses 10, 15 years down the road. And a single case manager at MHA can keep dozens of kids every single year from getting lost in the symptoms associated with anxiety, depression, and substance use disorders. But imagine for a moment when that caseworker, that case manager doesn't exist anymore. And now each taxpayer is having to foot the bill for police departments and prisons and hospital emergency rooms and the social safety net. They're going to keep trying, but at the end of the day, it's a valiant but failing effort to try to respond retroactively to all the results of dozens of people who now have the mental illness that we could have prevented 10 years earlier. In Wichita alone, the cost of these efforts reduce our city's GDP by about $2.5 billion against a citywide GDP of $44 billion. So we have a 5.5% low-hanging fruit opportunity to increase the economic impact of the city by preventing those mental illnesses in the first place, but we're not doing it. Our internal projections at MHA show that our current program offerings The first thing that would have to go would be programs that are designed to house and provide mental health care for veterans. Veterans are a group that's already 50% more likely to experience homelessness, and which are taking their own lives at a rate of 18 veterans every single day. That's stoppable. The proposed Medicaid cuts obviously would come at an unfathomable cost, both financial and in terms of human life. At MHA, those funds fund preventative services, and I understand that prevention is harder to see than treatment. I deal with that every day. Our treatment programs are funded, but no one can see prevention. If you ever had a cancer screening, if you've ever gotten a flu shot, if you've ever eaten a salad, which I have not, then you've taken preventative measures for yourself. And the least among us are no less deserving of that. So continued access to preventative measures is only available if our elected officials have the foresight and the moral fortitude to do what's right for their constituents, and we certainly call on them to do that. Thank you.
Yes?
I have a question for him.
Oh, sure.
Oh,
Are you familiar with Justice Together?
I am.
Okay.
Yes.
Okay.
Yeah.
I just wondered because mental health is one of the two issues that
Absolutely.
we're working on.
Yeah.
fantastic. All right. You have a question?
One quick one. Have you had a chance to give your story to Senator Moran, Senator Marshall, or Representative Estes?
He just did. Because it's all, that's gonna go.
I mean, face to face.
Yeah.
So the question is whether he's had a chance to give his story face to face to the congressional delegation for District 4.
I personally haven't, but the person I report to, our chief executive officer, is very involved in advocacy. In fact, MHA was founded nationally on the basis of education and advocacy. So we have a very active lobbying presence both nationally and locally here in Topeka. We sent a group of 50 people just from our agency to Advocacy Day, what was it, less than a week and a half ago, maybe something like that. So as an organization, we are very involved in advocacy, yes, sir.
Do you get access?
Yes, we do. Our CEO not only chairs the State Substance Abuse and Mental Health Coalition, she served on Governor Laura Kelly's, what do they call it, the panel that selected the location for the new state hospital. She was personally appointed by Governor Kelly to that panel, so we have very good access. Yes, ma'am.
You're lucky.
Yes, we are very lucky.
Not have access.
Yes, I agree.
Thank you so much. Okay, we have some time, and certainly there is an opportunity for people to come and speak from the audience. I think Leroy Burton would like to do that, and we're excited to have you up here.
Thank you, April. My name is Leroy Burton. I'm from Elreda, Kansas. I represent the Kansas Silver-Haired Legislature. We represent 640,000 senior citizens in the state of Kansas. And I came over to support today because we're very concerned about Medicaid. We as a group have been advocating for the expansion of Medicaid in the state of Kansas. And you guys can see the numbers as well as I can see the numbers. But let me give you a few here. 53% of our nursing home people depend upon Medicaid. We lose it, what are we gonna do? Where are they gonna go? I looked at your number a while ago. 14% of Kansans get Medicaid. 14%, that was a number. That was a number. Another 8%, if we expand Medicaid in the state of Kansas, would then become eligible for Medicaid. That's about 150,000 people. They have no insurance right now. So there's some big numbers that are coming out of that and being able to be used. I hate to just throw numbers at you, but since this is Sedgwick County, it's by the Kansas Department of Health and Environment. There are 15,896 more uninsured Sedgwick County residents could become eligible for Medicaid. Almost almost 16,000 Sedgwick County residents. That would make about a little over 5,000 jobs in Sedgwick County. And this is a staggering number. That would bring in, they're predicting $160 million to Sedgwick County. So we as a group of Silverhead legislators are trying to support this as much as we possibly can. We've supported it for the last 3 years really strong. We supported it this year really strong. And I have some bad news for you since the legislature's out of session. The Silverhead legislator had a bill for medical cannabis that was presented in March 7th of this year, didn't come out of committee. Medicaid Expansion, the Senate bill, February the 10th, didn't come out of committee. House bill 2375, February 11th, didn't come out of committee. We also worked with CAPERS. Any CAPERS recipients in here? We have supported this year, tried to get a COLA for CAPERS. When's the last time you've had COLA? Cost of living increase. 1998. 1998. Okay? We asked for 5%, didn't come out of committee. Okay? We've also asked increased funding for the Senior Care Act. No bill was ever introduced. The community-based transportation for senior citizens, to increase that and make that better, no bill was ever introduced, and get a bill introduced. So we are working hard and trying to help you, but in a way, it's kind of a, I guess, kind of a backhanded compliment or something. If we'd got Medicaid expansion in Kansas this year, we're one of 10 states, one of 10 that doesn't have it. If we'd have got it, our legislators would have said, we're losing $880 billion, so Kansas, where are you going to get it? So maybe it was a blessing that we have it, but now we sure could use it. We really could. We're a non-political group. Silverhead Legislature is a non-political group. But I encourage you to talk to Dan Hawkins and Ty Masterson. Unless you can convince them to let it come out of committee to get on the floors, it's not going to happen. And we're continuing to talk to them and work with them and do whatever we possibly can because we see the need. There's 640,000 of us that are senior here. I think I'm a silver hair. Jerry, am I silver hair? Yeah. I qualify.
Crossed over.
So, thank you for the time.
Thank you. I think that's at least our second speaker who has said that at the Medicaid level, we really need more of that in Kansas as opposed to less. So I appreciate those comments. Would you like to speak?
Yeah, I believe I should.
Okay.
My name's Norman Scott. I'm from Kansas City, Kansas. And I have a granddaughter that's handicapped. And my daughter tried to put her through school, public school. She couldn't do science and then math and English and all the stuff. And as a result, she was separated from the class, put in a corner, or put in a different room with a para. And the para said, you can do this. Well, she couldn't do this. But they kept telling her that she could do this. As a result, she got what an attitude. She got meaner and meaner, and either my daughter or I would have to go get her from school. So that was her life. She graduated, and I think she's 26 now, and she just learned to write her name. So, 2 points I want to make. This young lady here in the blue takes care of her mom. It doesn't affect just the person with a handicap. It affects everybody around them. Your whole life has changed. My whole life has been changed. there's a constant worry about her, my granddaughter, doing something. So, I have to be a little political here. We need to do a better job of vetting the candidates. I don't know how we can do that. But, Mr. Estes and, Mr. Marshall, sorry, I didn't think I missed his name, but anyway, they write to me all the time. They give me their reports and all this other stuff, and I write them back. The one that I remember about Mr. Estes was, he wanted to tell me all about Santa Fe Trail. I read it, and I said, I hate to tell you this, but it's been a long time since there's been any cows on that trail. Not something we need to worry about. So, it's not that I don't stay active. I do. I've been pretty active in Wichita County, but I'm getting tired. We need to vote. You know, I ran for office, and about 10% of the people vote for you. 10% vote. There's over 100,000 registered to vote. We need some way or another, we need to group up and get those people out and make them responsible for doing these things. I just want to say one other thing about the speech that Trump made, that these people that are handicapped don't vote, they don't make a living, they don't work, they don't this, they don't that. That's not true. None of that's true. And somebody needs to hold him accountable for that. But anyway, thank you.
Do you have anyone else who wants to share a concern that you might have? Particularly if you have a different perspective than we've heard, would you like to come up?
Well, I would just add one.
Well, hold on a second, because I don't know that people can hear, and I know for sure that you won't be seen. So would you be willing to come up?
All right.
Awesome.
We have one other kind of a question here. And the other part of the loss of health care, what about property taxes? So senior citizens can stay in their home. Property taxes are out of control, and we need somebody in the legislature to step up and say, hey, it's a simple fix, reduce the percentage applied to your assessed value. That's simple. That was brought up, I understand, by the Democrats, and never went anywhere. Surprise, surprise. But that would be a big piece, I think. It's the other part of seniors being able to stay in their home, which I think is critically important.
Yeah. Thank you. Yeah, you bet. When we talk about property taxes, a lot of times that's a state level thing. But if there are people, it's certainly all connected together, and it impacts health and well-being as well. We probably have time for one more person. Would you? Okay.
Hi, my name is Melissa Dodge. I actually live in Derby. I had no intention on speaking tonight. I am just so inspired by this room and the stories. And I have actually spoken on this issue before, so I know the bravery that it takes to come up. And I can even explain how much I'm shaking right now. I actually have a little bit of a piece in almost every little pocket of the Medicaid conversation. I personally advocate for Medicaid expansion as somebody who lives in the can-care gap. I'm a single mom of 4 kids. 2 of my kids have special needs. I have spoken to my legislators in person multiple times, and they have no problem telling me no, and they have no problem knowing that I'm going to come back and they're going to have to tell me no again. So we have this really fun game kind of going, but, we both know it's going to happen. So also, all of my children receive Medicaid. My daughter was born with hypoplastic left heart syndrome. She's had 4 open heart surgeries. She's had 27 surgeries total. She had a trach for 5 years and a feeding tube. She's been on the waivers. We've had the in-home nursing. She wouldn't be alive without the support of Medicaid. Plain and simple, I can't even sugarcoat it. She wouldn't be here today. I have a son that's also autistic with depression and ADHD, and he's actually currently inpatient due to those diagnoses. I wouldn't be able to get him the resources and help he needs to fight for that mental health if it wasn't for his access to Medicaid. Even for my normal children, if we're going to call them that, just to be able to do the everyday PCP visits and the dental visits and the upkeep, it's so vital and important so they can set the foundation for being adults and the health that they need. I fight a lot for Medicaid expansion for the quality of my own care because I believe that I deserve the access to that as well. And then the other piece that's way less fun to talk about, but I think is really important, and I think April touched on it just a little bit earlier. 2 years ago, I suffered an ectopic pregnancy and I had to have a life-saving surgery. I was bleeding internally and I lost my left fallopian tube and about a liter of blood. And I was able to get on Medicaid for 1 year with the pregnancy coverage. And that helped me with the almost $10,000 medical debt that began coming my way. And I was able to get into therapy immediately to deal with the grief and the loss and the trauma that came with that. And they're actually talking right now in legislation about shortening the 12-month post-pregnancy availability to coverage. So you can't fix everything postpartum or things like that in 6 weeks. So it definitely takes that long. So I had that access, and obviously that's gone now, so it's been 2 years. But that was a vital part of keeping my physical and mental health there so I could be for my other children. So that's a little bit about my story. But I just, more than anything, want to tell you guys, I'm just so inspired and encouraged. And I just know that sometimes it's so intimidating to tell a legislator what you think and how you feel, but they do need to hear it. And I know that you're like, but they're going to tell me no. Yeah, they're probably going to tell you no. They're probably not going to want to talk to you. But you have to keep calling, and you have to keep talking, because it is worth it. Because there's this many people that came tonight, but there's way more that thought about coming and just didn't make it, or couldn't get off work, or somebody's speaking for somebody else. So I just thank you guys for coming, for people like me and my family and my children, and I just appreciate you all so much. So thank you so much.
About 2 minutes, but I just am curious, do we have any providers in the room that might like to speak? Healthcare providers?
I'm not a healthcare provider, but I do have a different person.
Come on up and, I hate to do this to you, but just as quick.
I will be as quick as possible. My name is Mary, and I am a veteran. I am an independent insurance agent and health equity advocate. And what we have heard is individual stories. How many of you watch proceeding sessions, press conferences every single day? People tell me to turn off my TV. Stop doing it, and I will not. And the reason is because health care is not an entitlement, it is not a privilege, it is a right. I work with hundreds of people from all different demographics and all different socioeconomic levels. And every single one of these people deserve to be cared for. They deserve the same preventive care. And I do everything that I do for people who have limited resources, disabilities, who need that home health care, the home and community-based services waivers. I work with all of those people pro bono, okay? They told me a long time ago I'd never get rich if I decided to work with people who were eligible for Medicaid, and I said, okay. But the thing is that please understand that there are people who do not understand that you have value, and we need to make them understand. And so my time is up, I know, but please continue to speak out. But more than anything, please get people to vote, because that is the one thing that they do understand. They may not understand your humanity, but they will understand your vote. And so please speak out, and please know that you do have value.
Thank you so much. I just want to thank everybody who came out. We do have a petition on our website, expandcancare.com. We would love, if you haven't signed the petition, asking Congress to not cut Medicaid. We'd love for you to do that today. Otherwise, thank you so much for being here, and we'll be around for a few minutes if anyone has questions or things they want to talk about. Thank you.
Thank you.